Today's Monday Medical Minute is going to be talking about the difference between plain X-ray, CT scan versus MR scan. What is the difference? This is a plain X-ray. This is a CT scan, and this is an MRI scan. And they're both of the knee. They're both in the lateral position, so you're looking at the side of the knee. And I'm going to talk about the differences. Let's talk about radiation first. A MRI scan does not use any radiation. A X-ray uses radiation and a CT scan has radiation. And we measure radiation by a unit called a millisievert. And that's how much radiation your body will absorb when you're getting the CT scan or getting the plain X-ray. Basically, it can be translated into how much your body would absorb from the natural environment, how much radiation your body would absorb from, example, the sun. We convert that into, for example, the CT scan of the spine, you get 6 millisieverts, which is basically 3 years of background environmental radiation, versus a CT scan of the knee is equal to about 6 months of background environmental radiation. Starting with the knee X-ray, lateral view of the knee, it's excellent for assessing bone, fracture, arthritis. Radiation dose is 0.1 millisievert, which is only the equivalent of 10 days of background radiation. So not much radiation from getting a knee X-ray. CT scan of the knee, again, a lateral view. It's good for assessing really small issues with bone. You can see this patient actually has a small fracture right here. So it's excellent for looking at fracture. It's good to assess the degree that a fracture is healing. Now, it has much higher radiation than a plain X-ray. It's one CT scan of the knee is equivalent to 6 months background radiation, where remember the knee X-ray was only 10 days. MR scan, lateral view of the knee, excellent for soft tissue assessment, such as ligaments, excellent for assessing infection, tumor, and bone quality. No radiation. Plain X-ray, CT scan, MRI scan.